and we're here to talk about common dental indexes for dental fluorosis. Now, what is dental fluorosis? Dental fluorosis is a form of enamel hypermineralization due to excessive indigestion of fluoride during the development of teeth.
Okay, so one of the indexes for dental fluorosis is DDE, or Development Defects of Dental Enamel. The purpose is to score enamel opacities. The procedure is you will select 2 teeth that have the most opacities, then you will dry it for 2 minutes, and then you can score it. And the way that you score it is if it's 0, it means there's no fluorosis present. 1 to 2 is mild fluorosis, 3 to 9 is advanced, and you'll see those changes in the enamel. And an example question would be, what is the prevalence of caries and developmental defects of enamel in 9 to 10-year-old children living in areas in Mexico with different water fluoride amounts?
Okay, so another common dental index for dental fluorosis would be the Dean's Index for fluorosis. So the purpose of that is it rates fluorosis within a population to sensitive, mild, through severe cases, and the procedure is the same as the DDE index. So the classifications for the Dean's Index would be normal. So you'll see smooth, glossy, pale, creamy, white, translucent surface. So no fluorosis. Questionable would be like a few flecks or white spots on the tooth. Very mild would be small, opaque, paper white areas covering less than 25%. Mild would be opaque white areas covering less than 50% of the tooth surfaces. Moderate would be all tooth surfaces affected, marked wear on the biting surfaces, and then even some brown stains may be present. Severe would be all tooth surfaces affected, and then you could have some pitting, and then as well as brown stains are present. A example question could be, what is the estimated prevalence and level of fluorosis attributable to fluoridation using Dean's Index of Fluorosis?
So now we're going to get into the fluorosis risk index. So the purpose of that is to assess fluorosis, particularly the specific time of the enamel formation. A procedure could be dividing enamel surfaces of permanent dentition into 2 developmental relative surface zones. So classification 1 for enamel formation begun during the first year of life, and classification 2 for enamel formation begins in years 3 to 6. So a scoring, how you score that is you give each zone a negative for fluorosis or a positive for mild or moderate fluorosis. Zone with more than 50% displayed of pitting, staining, and deformities indicate severe fluorosis. Now an example question for that could be, is there an associated between enamel fluorosis and infant given formulas?
Okay, so now we're going to talk about the last index for fluorosis risk, and it is Tooth Surface Index of Fluorosis, or TSIF. The purpose is to rate fluorosis within a population more sensitive than the Dean's Index. And I'm just going to go ahead and do an example question right now. It would be, what fluorosis effects are seen in people living in a community with 4 times the optimal concentration of fluoride? And now we're going to show you how to score it.
Okay, so I'm going to go over the score for the Tooth Surface Index of Fluorosis. So if you have a score of 0, you would have no evidence of fluorosis. So a good example would be okay, and then a score of 1 would be parchment white fluorosis would involve less than 33% of visible tooth surface. Okay. An example for a 2 would be parchment white fluorosis that involves more than or equal to 33% but less than 66% of visible tooth surface. These are some examples here. All right, and then for a score of 3 would be parchment white fluorosis that involves greater than or equal to 66% of the visible tooth surface. Okay, so for the scoring of 4, the enamel staining occurs in conjunction with any preceding findings. For the score of 5, discrete pitting of enamel surface occurs without staining of intact enamel. For score of 6, discrete pitting of enamel, as you can see the pitting in the front here, and staining of intact enamel occur. And then for score 7, as you can see, the staining is really bad. Enamel surface shows a lot of pitting, large areas of enamel may be missing with altered tooth anatomy, and dark brown stains are present.
All right, so now that we know what fluorosis looks like, we can identify it in a clinical setting. Bye, thank you.